The #1 killer of women? Heart disease. This isn't a new statistic, but until recently, cardiac problems were thought to be a men's health problem. When you think heart attack, most people think crushing, severe chest pain, but this isn't always how it presents. Women have a tendency to downplay our symptoms, ignore our symptoms, suffer in silence, and we end up receiving treatment later, sometimes too late.
More women die in the United States from cardiovascular disease than men, so we need to get the word out. However, with women, the symptoms are much more subtle. They very often are shortness of breath, some discomfort in the upper chest feeling, nausea, and many times women will wait this out, and often their healthcare providers don't associate with heart disease also.
And I think sometimes women feel almost silly to sort of draw attention to themselves.
Yeah, even if they do feel that there's something going on, very often they delay because they say, well, I gotta pick up the kids, I gotta make sure my mother's taken care of, gotta do the grocery store. And what we do is spend a lot of time with her integrating or asking her about symptoms. Then we do a quite comprehensive cardiovascular exam, our body mass index, our body fat percentage, and our waist measurement. We'll interrogate them about their family history, and then we'll put it together and look at their risk. Then we'll educate them. We'll spend a lot of time teaching them exactly how to try to get their particular risks into the most ideal range.
So Joanne, when did you learn that you had heart disease?
I've been an athlete for many years, and every time I tried to run, I'd get this kind of odd pain. It just was weird, didn't go away, it really hurt. And they did some tests and they said, we'll go upstairs, get an EKG.
What was your diagnosis? What kind of heart disease do you have?
Well, my arteries were clogged. One was 99% clogged and another was 88% clogged. I competed at a very high level. I was fit, I ate well, but that was never even on my radar.
And how do you feel today?
I feel great. I mean, within a couple of weeks, I was back to normal again, and a new normal.
So Mary, give me the most important things women can do to protect their heart today.
The most important thing that they can do is to incorporate a healthy lifestyle. Heart-healthy diet, 30 minutes of aerobic exercise about 5 times a week, and then women need to know their personal risks. And at the end of our screenings, we always ask each woman, tell 3 of their friends what they just were able to learn about heart disease from their screening, because that's the way we need to get word out.
February is National Heart Month, and this is a great time to see your doctor, get your heart checked out, learn about the symptoms of heart disease, and take steps to protect your ticker for a long, active, and wonderful life.